Okay, this video is a book review about whether or not that condoms don't work. Okay, I just read this book really fast. I was kind of surprised. Basically, condoms don't work as well as people think they do. The rate of getting pregnant in a year or using them is about 14%, even when they're used correctly. The most effective birth control was oral contraceptive pills, and they're claiming even with those, of as many as 5% still get pregnant. It depends what study you read. Some of them will give lower numbers. Diaphragms are a little worse, 16% pregnancy. Rhythm method, they say 16%. Spermicides alone, about 25% incidence of pregnancy. Full use for a year in couples. Some of the problems is that condoms, well, even if they're so-called new, will have some microscopic holes in them as big as 5 microns. And the virus particles can be as small as zero point 0.1 microns, so they can still even get through with an intact condom in some setting, according to this author. They're less effective at preventing infections than is widely realized. So one has to be very careful who they're having sex with, because the risk of sexually transmitted diseases is much higher, I think, than most people are aware of. Lambskin condoms are a bad idea. They're more porous than the latex condoms. Latex is what's typically used with surgical gloves as well. Latex is also better than polyurethane condoms. How many days is it possible every month for a woman to get pregnant who's premenopausal? About 3 or 4 days per month. A lot of men also store condoms in their wallet and then they sit on it, and that'll have a tendency to damage the condoms. A lot of men leave condoms in their glove compartment, and the car can heat up on a sunny day and that'll damage the condom. It can be transported on a truck that's out in the hot sun or stored in a warehouse in a hot area, and that also can damage the condoms. They have expiration dates on them, and once they're past that expiration, there's often like a liquid solution on them, lubricant or whatever, spermicide, that can be expired, and they're less effective in that context. Some of the spermicides, though, can be irritating to the genitals of the man or the woman, and that irritation can subsequently decrease the skin barrier and increase the risk of infection. Herpes and HPV, for example, genital warts, can be spread by the skin-to-skin contact that happens above the condom. So it's a real concern. STDs, of course, can be spread by oral sex. That's more risky than was previously thought, including for HPV, including a type of nasopharyngeal carcinoma, HPV positive. So the smart move is be very careful about who you're making the two-back beast with. Anyways, I thought that was a little bit interesting. I think young people overestimate how protective they are for prevention of pregnancy as well as for prevention of sexually transmitted disease. There's a very high incidence of sexually transmitted disease, and people should be careful, because I have friends who have friends that are actively practicing OB-GYNs, and they say the incidence of sexually transmitted disease is very high. Plus, I also know from my conversations with young men, they tell me that they're kind of annoyed by the women. They say women are too promiscuous these days, they really kind of different attitude than we had when I was young. When I was young, I saw how happy my parents were. It was guaranteed in my mind, I'm going to find a wife, we're going to have a nice big family, we're going to live happily ever after. And whereas these guys nowadays are like, these women are too promiscuous, you can't trust them as a wife, you get divorced, sold into slavery. I think a lot of them, they just don't want to get married. Also, women are even more than ever interested in getting more and more educated. And so I think a lot of them are delaying their pregnancies, and a lot of them are becoming infertile, will never have children. That's what I'm seeing. But anyways, condoms are not as safe as one thought, so one needs to be very careful who they sleep with.